Attention deficit hyperactivity disorder, known as ADHD, is said to be the most common childhood brain disorder by the National Institute of Mental Health. While ADHD is most commonly diagnosed in children, it is possible that adults may be diagnosed with ADHD as well. There is a large amount of controversy about patients who are diagnosed with ADHD. People disagree about a variety of things such as validity of diagnosis and effectiveness of various treatments. Historically speaking, ADHD is generally thought to be a childhood disorder. However, lately there has been data to prove that adults can also be diagnosed. Most patients diagnosed during childhood carry the disorder into adulthood. It is seen in studies that over 50% of adults who have ADHD were diagnosed as children. Women were less often to be diagnosed as a child, and around 80% of diagnoses made were male. The disorder presents different symptoms in adults than in children. Adults are first evaluated according to their personal account of symptoms. Some of these symptoms may include problems with organizational skills, being easily frustrated, unable to prioritize, quickly tempered, impulsive, trouble coping with stress, finding it hard to finish tasks, trouble keeping a job, and defiance in the workplace. The individual may also forget important engagements or speak out of turn, giving no thought to what he or she is saying. Personality traits of the individual may range from being creative, intelligent, and driven, or worrisome and an underachiever. Persons having ADHD throughout childhood seem to undergo changes as an adult. In place of hyperactivity, adults tend to have feelings of being completely out of control. Although some adults may be able to exercise self-control while sitting in a lecture, they probably will not be able to comprehend anything being said. They may also experience problems with short-term memory and math skills. Studies conducted by Dr. Julie Schweitzer on adult males with and without ADHD reveal a difference in the brain. The men without ADHD had no problem with giving strings of numbers. However, the men with ADHD had trouble recalling stored information while processing current information. Symptoms in children may include rage, aggressive behavior, hurting other children, and learning disabilities. There are various treatments for ADHD patients. There are several different drugs used for treatment. One that is fairly common is Ritalin. Side effects related to Ritalin include loss of appetite, insomnia, and severe mood swings. Adderall is another drug that is used for treatment. Common side effects of Adderall are headaches, sleeping problems, dry mouth, and fever. Aside from drugs, there is a natural approach to treatment. According to an article published in Infants and Young Children, treatments can include herbs, homeopathy, nutrition, dietary supplements, acupuncture, therapeutic touch, and massage. There is a large amount of controversy over the effectiveness of natural approach treatments versus prescription approach treatments. There is a lot of debate between a large number of people about what the cause of ADHD truly is. Large amounts of research has been conducted and many various possible conclusions have been drawn. Some physicians think that poor nutrition is a cause for ADHD. The remedy, they say, is to cut out all sweets and foods that are high in fat and sugar content overall. Others view the disorder as simply a lack of behavioral skills and discipline. They believe that if a parent takes control of their ill-mannered children, there would be no need for drugs. Although on the other side of the coin, there are people who think that this is nothing short of frustrated parents pushing their children to be adults. Furthermore, they believe that ADHD is not an actual disorder at all, but rather a normal childhood response to their environment. However, there are others who view ADHD as having nothing at all to do with parental control, but consider the brain to be the cause. There are companies working to test equipment to better diagnose ADHD using brain sensors. This method is still being studied as a reliable diagnosis or tool. Another problem cause to consider is genetics. Many physicians think that genetics and heredity cause ADHD. In an article written by David Dreamer, he states, most practitioners in the field now agree that the characteristic problems of people with ADHD stem from a genetically based neurobiological malfunctioning. The prevailing finding is that the activity of groups of inhibitory neurons located in the frontal cortex of the brain are depressed and unable to inhibit and control information from lower brain structures. Currently, the debate about ADHD is ongoing and remains unresolved. In any case, children and adults are suffering from something very real. Whether it is caused by a child's environment or biological makeup, it will continue to be constantly debated until concrete facts are proven. The study of ADHD is an ongoing process, and advances in medicine are being made each day to clarify and better understand this disorder and the people that it affects.